Okay, so let's talk about fat embolism in the lung. So, where the fat embolism even come from? Think about a fracture in the bone. And why bone fracture? Because lipid embola usually comes from bone marrow that goes to the blood and enter the pulmonary systemic circulation. This is usually the source. And this fat embolism can be complicated and therefore can have has high mortality if it's complicated by ARDS, acute respiratory distress syndrome. So fat embolism, remember that it can be complicated by ARDS. Remember that this fat embolism from the broken, I don't know what, for example, any bone, I don't know, tibia, fibula, femur, whatever you want, can go to the lung, but it can also go to the systemic circulation. And if you talk about the systemic circulation, don't think only about the lungs, think, think also about what is above the lungs. Think about the brain. It can also, or the spinal cord, it can also affect the CNS, and you can have fat embolism in the brain, stroke from fat embolism. Think about it. Now, when we're talking about the lungs, and I many talk about the lungs, let's talk about the radiographic features of fat embolism. So, initially the lungs are clear, and suddenly those patients develop dyspnea. And what you will see is interstitial and alveolar hemorrhage, or what will happen is interstitial and alveolar hemorrhage. And as a result of it, you will have the radiographic features, opacities. Look for them. But remember a very important thing. It takes time to those opacities to develop. It takes not just 1 hour, 2 hours, 48 hours it takes for fat embolism to the lung with all the hemorrhage and all the interstitial hemorrhage, alveolar hemorrhage, all those that cause opacities will take 48 hours to develop that you can see them. It can develop, but you will see them after 48 hours. And remember this. You can have clear lungs and still the patient will have dyspnea and will have fat embolism that you don't see. And those opacities takes time to disappear, usually around 3 to 7 days to those opacities as complications from fat embolism to the lung to disappear. So those are the main things that I wanted to talk about in fat embolism to the lung. Remember again, fat embolism comes from the bone marrow. Bone marrow is from the bones, so it can goes to the systemic circulations to the lungs, but also remember that it can go to other places, for example, the CNS, the brain, strokes. And in the lungs, it can cause hemorrhages to the alveoli, to the interstitial, but it takes time to the opacities, to the radiographic features to appear. 48 hours. This patient can develop dyspnea and you won't see anything in the imaging. Remember this. So 48 hours until those features in the imaging from fat embolism in the lungs appear. And it takes around 3 to 7 days until they disappear. Remember that it can have high mortality rate as complications from example from ARDS, acute respiratory distress syndrome. But remember that this is a type of non-cardiogenic pulmonary edema, and this complication can cause high mortality to the patients with lung fat embolism. Thank you very much. And this was about fat embolism in the lungs. And that's it.